Welcome to our bi-monthly spinal cord injury in-service. This month, we're having Dr. Tommy No discuss adaptive equipment for ADLs for individuals with spinal cord injury. With that, Tommy, take it away.
Thanks, Dr. Abramoff. Thanks everyone for coming. I think I'm one of the PGY2s, PM&R residents. I think, this is going to be a little bit more geared for some of the residents, just kind of help us think about what patients with spinal cord injuries, things they'll need, use, that'll be helpful for them to be more independent when they go home. Some of it has some like newer things and hopefully some more exciting things. And some of it's just kind of basic adaptive equipment that any therapist who's on is probably going to get a little bored of seeing, but I'll try to make it brief, not to go into too much detail, because some of it I think is kind of beyond the scope of this. So kind of just off the bat for ADLs, I don't want to go too much into ambulation mobility, just in the setting that, I think it's a whole topic of different things that will help, obviously, like that they use to help with mobility, but I think there's just so much nitty-gritty details. But obviously we have orthoses to help patients with like drop foot, things like that, prostheses, walkers, rollators, wheelchairs, standing frames, and gait trainers, and obviously different levels of spinal cord injuries will require varying levels, and I think it's very like dependent on the patient. Obviously, with wheelchairs are going to be more common in patients with spinal cord injuries, especially when they're complete, and walkers more so when they are incomplete. Other adaptive equipment for mobility, there's like the bionic walking aid, which kind of has this little, not sure if you guys see my mouse, but on the right picture, there's the attaches at the hip and the knee to kind of help raise the knee with hip flexion. There's a leg lifter to help patients with transfers. And then the cool thing that everyone likes to talk about now is exoskeletons and gait trainers that help patients kind of learn to walk again more on their own. Not still fairly new and still kind of on the rise. More so into feeding and grooming ADLs. And so for most, I think for all the therapists, these are like the bread and butter things that they'll see. The scooped and curved plates. Obviously, they typically have like non-grip on the bottom, help patients with poor fine motor, help them kind of, get the food on the spoon and help them eat a lot more. There's curved utensils for patients who, again, decrease fine motor. Down here at the bottom, the universal grip helps them hold their utensils to help eat. And then the rocker knife allows them to cut foods without requiring two hands. And then over here on the left is the mobile arm support. And kind of just thinking in individuals with spinal cord injuries, some of the things that I guess come to mind for me is like what motor, if you have a motor complete spinal cord injury, so ASIA A or B, what motor level are you typically thinking of when patients are using these? With the mobile arm rest, obviously you're thinking around C5, right? Because they still need to have that shoulder abduction and some elbow flexion to kind of utilize the mobile arm rest. Obviously with incomplete, they'll have probably some, if they have some motor function beyond the level of that injury, so ASIA C or D, where they're able to kind of still use like some grip, then it's a lot more beneficial. But you can combine this mobile arm rest with other adaptive equipments. And so same thing with the universal cuff. If you're thinking someone has, who needs, like, what needs to be preserved at the very least to be able to use this, and it's typically also around C5, C6. C5, they still have the ability to combine it with a mobile armrest and be able to flex their elbow to kind of bring that utensil to their mouth. Same thing with curved utensils. If you're combining with universal cuffs, you can do as patient with a C5 motor level complete can use this, but C6 as well, because C6 is our wrist extension, and so you can do tenodesis, which I'll get into in the next slide, to kind of help hold the curved utensils. And then the rocker knife, I'd say C6, C7, probably more so C7. If you're needing to rock the knife back and forth, you're probably using some supinator pronation, and so you're thinking more pronator teres is obviously more like C6, C7, and so likely around that level of motor level injury to be able to use that. And so tenodesis, many of the therapists will know this, but for some of the residents, it's when you use your wrist extension to bring the fingers into passive finger flexion. And so what that does is it allows them to kind of weakly grasp objects, and can be a skill that they learn to use to hold objects. On that note, there are some adaptive equipments that really take advantage of tenodesis, and so there's this terrifying looking contraption here, but it's the quad tool reacher, which essentially attaches to their arms, and there's multiple extension lengths that they have available, but takes advantage of tenodesis, where all they have to do is do wrist extension, and it causes the grip, the little prongs at the end, to grasp objects. And if obviously depending on patients' strength and wrist extension, can have pretty strong grip. Additionally, there's a pretty cool variant of this quad tool reacher I found, where if patients don't even have tenodesis, but let's say they're C5 motor complete, but aren't really able to wrist extend, there's the variant of this called the sip and grip. I couldn't find it anywhere online available, but essentially they instead of using tenodesis to activate the pincer maneuver, it uses this little blow valve, or really sip valve. So you essentially suck air through it, and then it causes the arm to contract and grab objects. Additionally, there's all sorts of variants of this, but the one I found was Obi, which seemed pretty neat. Kind of takes advantage of those non-slip cups and plates, and the curved bowls, and essentially you have to get someone to program it for you, so this patient will probably be setup assist, but what it allows them to do is they can program it using these buttons here, to not only to adjust the height at which the spoon delivers the food, and they use the green button to kind of transition. It'll rotate the 4 bowls here in a circular motion, allows them to pick their food, and then the blue button, you press that to activate it'll scoop the food into the spoon and then bring it to the appropriate height that it was programmed to do. And so this, you can probably have a patient independently eating with this if they're C5 motor complete, because they don't, or even possibly low, but they need to have some ability to press the buttons. In terms of grooming, a lot of these are very basic adaptive equipments. There's, I think, the universal grip, like we talked about before. There's the long head brush, and as well as the razor holder. These kind of allow them to reach, a lot further than they typically would, especially for the brush, if they have some weakness at C5. These are, the one on the top left here is a single-handed nail clipper, so it allows them to just press down on this black lever here and triggers the nail clipper. If they don't have the strength to do that, there are these automatic ones where all you have to do is insert your finger, it automatically detects it, and then it will clip the nail for you. So some pretty cool. I thought that was pretty neat. And then the self-inspection mirror, of course, kind of similar, just to allow them to evaluate for skin breakdown. Now, to physically use them, you kind of need some grip strength. So with a single-handed nail clipper, you're probably gonna need about C7 to like do some arm extension to press down on the nail clipper for the single-handed nail clipper. The others, it's probably C8 to be able to use it. But if you're thinking, to physically use them, this is the appropriate level. But to, I think, take most of the benefit for them, I think, to use a razor like this, someone who's C8 motor complete could certainly benefit from it. But there's also the question of like trunk control. So probably more so like thoracic level would be where you're getting the most benefit from it. In terms of dressing, I think there's the dressing stick, there is the button loop and the zipper puller, and then the grabber, of course. And for upper body dressing, and then so for some lower body dressing, there's the sock slider. The Dolphin Donner is something I saw as neat. It basically helps patients put on compression stockings. So if someone's kind of dealing with orthostatic hypotension, and also, has some difficulty with lower body dressing, this can be extremely helpful because essentially roll the sock onto the compression stocking onto this and then unroll it over their leg, and it comes off pretty easily. And then there's the shoehorn, of course. And then didn't go through really the motor levels. I think it's just fairly variable, especially with like in terms of how independent they can be. And typically when you're using these, you're probably more so looking at someone who's patients who are likely more motor incomplete for lower body. But for upper body, certainly these are going to require, the grabber is going to require some grip strength like C8. So I think something neat that I came across was that there are adaptive clothing brands that I wasn't aware of. And, something that's nice to just kind of be aware of, that patients will, may be helpful for them to know. And so what exactly is adaptive clothing brands do? Like what makes it adaptive? I thought some of the neat things were, Tommy Hilfiger, I only picked this one because it has the same name as me, but sensory wear, they use soft fabrics, heat press labels, so they get rid of like any tags. They use easier closure systems, so they try to use like magnets as best as possible. And then they have opening for like pant legs, they have more wider bases and kind of these little flaps to help with patients with prosthetics. And then seated wear, which was more relevant for like spinal cord injury patients who will have more commonly be in a wheelchair, allowing them to, it has a low front, so it keeps it from bunching up as much while they're seated, and it has a higher back as well. And overall, it just allows them to stay seated more comfortably. And obviously, for patients with higher level injuries, prevent some autonomic dysreflexia. Nike has an adaptive clothing line. It's under Easy On, and so you'll notice there's no laces. It's really just Velcro straps, and I thought it was kind of unique that you can still wear Jordans, without having to tie your shoes. This I thought was a really cool one of their Easy On shoes, where it kind of bends up and all the patient has to do is just kind of let gravity or push their foot into the shoe, and then it folds back down onto itself to allow for Easy On. And then these were all the various brands. And then so a lot of these are like the belts where you're just using like Velcro instead, but it looks like a normal belt. Same thing with Magna Ready. Many of them typically use more magnetic closure systems, or even if they have a zipper, it's like a very long zipper that the patients can easily access. This was me just having too much time on my hand, I got sidetracked and was trying to look into literature of like clothing effects on patients with spinal cord injuries. And I ended up falling upon this article where they did a lit review on like it's a textile school in Hong Kong that was looking into the clothing needs for wheelchair users, which I thought was pretty interesting. So there's, people working on this and trying to optimize it for our patients, which I thought was nice. Other advances in dressing, adaptive equipment, obviously very new things. Robotics, AI is all the buzz these days. I think a couple of years back, there was a school looking into like using a robotic arm to help with dressing, and at that time, I think it was just this one robot. More recently, there's a New England scientist who came up with this two-handed robotic system that is supposed to be able to mimic bimanual dressing that caregivers would assist humans with. And so obviously still on the rise, still in the works, but maybe sometime down the line in the future would be something interesting that allows patients to really go home more independently. So bathing and toileting, again, this falls into a lot of the adaptive equipment are going to be DME, durable medical equipment. And I think the various types of durable medical equipment is a talk in itself. So just kind of briefly going over it. So, obviously the main considerations are the bathroom space, their setup. Is it a tub, shower, walk-in? What do the user's functions look like? As well as what are some of the things they're dealing with, like positional spasms, orthostatic hypotension, or autonomic dysreflexia. You also want to be aware of any skin integrity issues, so making sure they have appropriate pressure relief and padding, and then obviously bariatric, the weight capacity for each equipment is pretty important, especially in patients with spinal cord injury who will have some metabolic dysfunction, and weight gain is a very big problem for patients, especially as they progress throughout their, along their journey. So there's the rolling shower commode chair. So kind of does both bathing, toileting, allows for them to have a pan underneath, as well as showering, although it requires more of like an open shower setup like I've shown here. This is actually, I think, a setup you can buy and try to have installed. It's like $5,000. And it has the caster wheels, which are these 4 small wheels. So it allows them to move around in the smaller spaces. Common features it'll have: tilt in space for orthostatic hypotension and pressure relief, reclining for limited hip range of motion, a belt for preventing falls, seat cutouts for commodes, lateral chest straps for trunk stability, and then padding, leg rest, all those things. There's the commode tub shower slider chairs, where on the left you can see it's you can use it as a commode, pretty much like a lifted commode seat, and then transition. Obviously, this is something where the patient's going to need a caregiver to transition them over, but it allows for less transfers where they can connect to the shower slider, attach it, and then just will have to transfer their legs over the tub portion. And this really minimizes the amount of transfers that patients have and really helps quality of life. Then there's the tub bench and bath lifts for patients who are able to transfer, and then the bath lift just kind of adjusts the heights for the patients to be in a comfortable seating position. And then, of course, shower boat for patients who are unable to safely sit due to wounds, orthostatic hypotension, or any other skin issues. Just some other like commodes and adaptive equipment that they may use. The padded drop arm commode, the arm allows for arm support while they're in the toilet, but also the drop arm allows them to transfer in and out easier. And then the padded seats, whether that's gel, foam, or air. Gel seems to have more even distribution of weight. And then bidets to help with kind of self-cleaning afterwards. Other adaptive equipments in bathing, obviously the long-handed sponge. I think for a patient to use that independently, and again, complete motor, probably about C8. The shower head handle, and then automatic soap dispensers. Small things that we don't really think about on our day-to-day, but makes a big difference for the patients with spinal cord injuries. In terms of bladder management, obviously self-cathing is a pretty common bladder management for patients with spinal cord injuries. So there's the catheter inserter, in which they do need to have a little bit of grip strength. So this may not be all that correct, but allows them to essentially hold the catheter much better, especially if they're lacking a lot of fine motor, and allows them to insert catheters a lot easier. Mirrors for a lot of the patients who have, especially when they're more bariatric and have difficulty visualizing the urethra. This is very helpful for them. And the pants holder for patients to allow them to, minimize the amount of things they have to juggle while they're doing self-cathing, and keeps the pants out of the way for them. So for females specifically, there's the Astacath, which you insert this little portion into the vaginal canal, creates kind of a channel for patients to self-cath much easier. There's the labia holder. It's pretty self-explanatory. And then it seems like Stanford has been working on the cath path. It's essentially similar to the Astacath, but you essentially insert this little rod and inserts like a tampon. And then it creates this small little channel where you can thread the catheter through to help with a lot easier catheterization. For males, there's the penis holder, and then there's the eagle board, this medieval looking contraption over here. Allows them to easier, this holds the penis in place. This is where you can place the catheter, attach it to a bag, and it allows patients to kind of self-cath a lot easier, especially while seated. For patients who have chronic like Foley's or suprapubic catheters and limited mobility, there's the electric urine bag emptier, where there's essentially a little rod between here that clamps down on the tubing that is the outlet, and you can kind of see it more so here. And there's a wireless version as well as like a manual version. So if patient's able to press the button, it will automatically create this, unclamp the tubing, and then they can drain it into either either in the shower or into the pan collection. And if they're unable to press the button wirelessly, or just don't like wireless technology, they can use this other form one, where they can actually pull it with their arm. So really only needing elbow flexion here, so about C5. And then they have also a variant where there's like a smaller wire where they can actually pull it and with just their teeth using their mouth, although I don't know how many patients would actually want to use that. And then for bowel, of course, on top of the commodes, for patients who have a little bit more upper body strength, there's a suppository inserter and the digstem. So this first one you can see connected is the suppository inserter, and essentially it goes in here. There's a spring-like system, and when they insert this into the rectum, this will push back, insert the suppository for them. So it's a lot less fine motor skill required. And then the digstem is the other attachment that you can add on. And then there's a toilet aid, which obviously insert some toilet paper here and just allows them to wipe to maintain their hygiene. So these are kind of most of the references. I got it from the AsiaSpinalCordInjury.org, had a list of many of these DMEs. I use the ADL ones. There's tons more that I was reading through that are very fascinating, especially like the structural modifications and transfer devices, where there's this oddly familiar name down here. Sounds like he probably has curly hair. And then Physiopedia had some great information as well. Not ADLs, more IADLs, but I thought it was cool. there's cooking for patients. These are kind of some of the there's like the easy grip knife, one-handed cutting board, and knob turners. Honestly, not a whole lot for makeup. And, if someone's wanting to retire early, maybe something to look into. But the most I found was this couple of things that, are definitely easier for patients with fine motor deficits. And then just, curious on what spinal cord injury patients with spinal cord injuries, their favorite adaptive equipments are. I asked on a subreddit in spinal cord injuries, and most of them gravitate towards grab bars, grabbers, or command strips. So, keep in mind a good grabber is their best friend, and even simple things like command strips to keep all their tools and utilities within reach is a life changer for them. So simple things that we don't think about too much, but good to keep in mind, like how we can create as a best environment for them. And that's really all I have.
Tommy, thanks so much for that great overview. I'll start by opening it up for questions and comments from the audience. Any questions? So, Tommy, when do you think patients should be introduced to this type of equipment?
Into the what?
Introduced to the equipment.
I would say, I think as early on as possible into especially their acute rehab course. I think, I think it's learning to use the equipment is one thing, like things like tenodesis. It's helpful for them to get adjusted to it as soon as they can, and feel like they're able to gain some independence as much as possible.
Yeah, I think, people tend to underestimate how much stuff is out there. There's really some really amazing equipment, and one of the obstacles obviously is getting it paid for. And some of it can be not super expensive, a lot of this, but, a couple $100s here and there, and it can add up, particularly people who aren't working and the setting of their new spinal cord injury. But at the same time, it can be really life changing and life altering. I was at a conference and a patient said that this device was really ended up being life changing. If I could pull it up here. Can you see it? Yeah. So I think he created something like this himself, like the beer retriever. So he said being able to just grab a cold beer when he wanted it out of the fridge on a tough day was really something that, changed his life. So you never know kind of what's important for patients. And a lot of times it takes some creativity and, actually building things yourself. But I think Tommy did something really amazing and kind of reaching out to the community. And that's a great way to kind of learn how people do these activities. Any other thoughts or comments? Well, that's great, Tommy. Thanks so much. We'll end it there. And as always, previous videos are going to be available on this video, and others are going to be available on the YouTube page for review down the road. Thanks, guys.
Thanks, everyone.